Today we are looking at the gastrointestinal system, basically the digestive system. So in the digestive system, of course, it involves right from the mouth, and where the mouth you have the tongue that basically helps us with the testing, help us also with moving, the food in the mouth to be able to just mix it with saliva. And then, of course, around the mouth, we have the salivary glands that produce saliva. And part of the function of saliva, it has some enzymes also. So digestion will almost begin from the mouth, where you're mixing the food with saliva. And then, of course, after that, you go to the esophagus, where now you're swallowing the food. And I believe in physiology, probably you'll be taught that the process of peristalsis, where there is contraction. In the esophagus, there is smooth muscle. Most of it has smooth muscle, so it's able to do what we call peristalsis, to be able to move the food bolus down. And so the food bolus will go down to the stomach, where further churning and mixing with the enzymes. Of course, the stomach will have some enzyme that is producing also with hydrochloric acid and other things that will be required for digestion in the stomach. Then we will go to the duodenum. Duodenum is the first part of the small intestine. And in the duodenum, we have usually three parts. We have the first part, the second part, third part, and even the fourth part. Then from the duodenum, so actually most of the digestion and most of the digestive enzymes will be found in the duodenum. That is where most of the digestion takes place, and of course also absorption starts there. Remember, around there in the duodenum, there is the pancreas, and we know pancreas is both an endocrine gland and it's also an exocrine. So endocrine in the fact that it produces hormones that are released into the bloodstream, and it has actions all over the body. So it has insulin, that is an endocrine gland. And then it has exocrine. It's an exocrine gland also, because it produces enzymes that are released through duct. There's a pancreatic duct that joins the common bile duct and enters the duodenum, the second part of the duodenum. As I told you, the duodenum has three parts. There's the first part, the second part, the third part, and the fourth part. So the common bile duct joins with pancreatic duct and join the second part of the duodenum. And from the pancreatic duct, there are released enzymes like amylase, lipases, and others that are released into the duodenum for the purposes of digestion. Of course, also bile has a function in digestion of food, especially fatty food. And so you have there the pancreas. So it's considered part of the GI system. Is basically accessory organs of the gastrointestinal system, because it brings in the enzymes that are required for digestion. Then, of course, we have the liver. And we know the liver produces bile, which, as I said, is important for digestion, especially of lipids, that is fats. It basically dissolves fat for the purposes of it to have better digestion and absorption. And so that's the liver there. And then, of course, after the duodenum, then you have the jejunum. And of course, in the jejunum also, little digestion takes place, but mostly in the jejunum and ileum, there is absorption of nutrients. That is, there will be a breakdown. Digestion basically breaks down if it is carbohydrate is broken down to glucose, and that is what the body absorbs, the glucose. And then so in the jejunum and in the ileum, that's mainly where absorption takes place. And then you go to the large intestine. You can see the appendix there. Then we have the cecum, the ascending colon, the transverse colon, the descending colon, the sigmoid, and then we have the rectum, and then the anus. So mostly in the large intestine, that is the ascending colon, transverse, descending. Mostly there is not much digestion that takes place, but mostly it is absorptions of fluid. And that is why the feces or the stool finally, when it comes out, is a bit solid, because most of the water have been absorbed from the contents of the intestine. So that is what we have. And basically all that part of the gastrointestinal system can be affected by diseases right from the lips, from the tongue, from the salivary glands, any part of that body, of that part of the GI system. The esophagus, of course, the most common one we know will be the esophageal cancer. That is the cancer of the esophagus. Of course, the stomach also, you can have cancer of the stomach, gastric cancer, or you can have ulcers, those are some of the most common conditions that people will talk about. The ulcers, gastric ulcers, or even in the duodenum, you can also have duodenal ulcers. And of course, just to think of the signs, symptoms of the gastrointestinal system would be things like vomiting, maybe diarrhea, nausea, anorexia. Yeah, and those will be some of the symptoms that somebody will come with, of course, including abdominal pain. So somebody will come with pain, saying they have abdominal pain. And so you will ask some things like whether there is vomiting and so on. And then, of course, when you go to examining the abdomen, as I told you, for most of the system, you start with, of course, general exam. The patient is sick looking, fair general condition or good general condition. Then you examine the main things, like for jaundice, you look for pallor, you look for cyanosis, look for finger clubbing, edema, lymphadenopathy, then the vital signs, the blood pressure, the pulse rate, the respiratory rate, SpO2, that is oxygen saturation of the blood, among others, all the vital signs, including the temperature. Because if there is infection of the gastrointestinal system, just like elsewhere in the body, you are likely to have fever. And it can be from any condition. It could be from viral infection. It could be from bacterial infection. And then, of course, we are examining the abdomen. Then you need to look. First of all, you inspect. And usually for you to be able to examine the abdomen properly, you need to adequately expose it. And a proper exposure for the examination of the abdomen would be up to the nipple region. That is ideally for male, you can put them up to the nipple region. That is the exposure up to mid-thigh. So you will be able to look at the entire abdomen, including the hernial orifices. You have to be able to see the inguinal region because you can have inguinal hernias there. You can have umbilical hernia. And then you have to look all the way. You know, there is the diaphragm that when you're breathing out, it can go up to the level of the fifth rib. And so when you're breathing out, sometimes the diaphragm can rise up to the fifth rib. And basically, it will mean like the abdomen goes up into part of the thorax. And that is why you have to expose properly so that you're able to have an access to the entire abdomen. So you have to inspect, that is look. And then, of course, you need to feel. You have to be able to palpate, that is, feel the abdomen, whether there are any enlarged organs. Especially, you feel for the liver, you feel for the spleen, whether they are enlarged. You should be able also to feel for the kidneys, whether are they enlarged or not. And you should be able to palpate. Down there, you can probably be able to palpate to make sure there is no pelvic masses, like from the uterus or even from the urinary bladder. And then, of course, after palpation, you need to percuss. Usually fluid, if there is fluid filling the abdominal cavity, the percussion note will be dull. And if there is air filling maybe the intestine or just the abdomen, it will probably tend to be tympanitic in percussion note. And then auscultation. Auscultation, of course, you're listening for bowel sounds. So there is a normal amount of bowel sounds. So if you have excess or if the abdomen is silent, it means there is a problem. Probably when you have peritonitis, that is inflammation of the peritoneum, usually the abdomen will tend to be silent. That is, if you listen to it, you can't hear any voice, any sounds at all. Because mostly the intestine in a setting of peritonitis will be paralyzed. So there will be no peristalsis of the intestine, of the small intestine especially. So you will have a silent abdomen in such a scenario. Yeah, and basically, when you have something like, for example, intestinal obstruction, the abdomen is distended and so on, then you need to do what we call digital rectal exam. You have to examine the rectum. You have to put your finger through the anal orifice and feel the rectum. Usually, most of our fingers would probably be like 7 centimeters. So it will go as far as 7. And remember, the rectum is around 12 to 15 to 15 centimeters, and the anal canal is just 3 to 4 centimeters. So with your finger, you are able to get to the lower part of the rectum. So if there is a mass there, you probably will be able to feel it with your finger. Yes, and of course, just like anything else, then you need to examine, do investigations, either imaging or lab work, that is, you take blood samples and so on, and be able to look at them, because all this should be able to help you make a diagnosis and make the right management. So I think that is basically what I would say. And then you can see for the second slide, you can see the salivary gland, which I said are important. One of the things that can be affected will be the salivary glands. And you see the major one, there are more than this. The major one will be the parotid gland, that is just anterior to the ear. And then you can see a duct that connects with the upper jaw. So it comes out into the mouth to be able to release the saliva. And then there is sublingual, that is below the sublingual, means below, just below the tongue. There is a gland there called sublingual gland. And then there is also submandibular gland. Those are the major ones. And all of them have ducts that connect into the mouth to release the saliva. And then you can see, just close up, looking at the salivary glands, you can see there is the ductules. You can see the cells that secrete saliva. So secretory cells will be secreting saliva. And then it gets into that ducts and come out and finally end up in the mouth. So there are those acilis. So basically, that acilis are those outpouching, basically a sac-like structure that contains now the saliva that has been released, and then it's finally released into the mouth. So we really have to be able to understand the anatomy of the saliva, because it can be affected as well. And then, of course, you can see a bit of the histology. You need to remind yourself, especially when we are looking at cancers, we can't avoid talking about the histology. That is the microscopic anatomy, what you're able to see under the microscope. Of course, this one is a diagram of the histology or microscopic anatomy of the intestine or even the stomach. So generally, when you look at this will be the general structure of the GI system, especially from all the way from the esophagus, the stomach, although there's a bit of differences in each area, the duodenum, the small intestine, and the large intestine. All of them has this general structure. There is the mucosa. Of course, you have the submucosa, and then that submucosa, between the submucosa and the circular muscle layer, remember, these are smooth muscles, of course. We have the submucosal plexus. Those are nerves. We call them sometimes enteric nerves. Enteric nerves, that is nerves that supply the gastrointestinal system. And this one, as you can imagine, it helps with the movement, the peristalsis, whatever. It's that movement that helps the contents, intestinal content, to be able to be pushed distally. Yeah, that is what that eventually it's coming out of the anus as stool. So we have the submucosal mucosa between the muscle layer and the submucosa. Then we have the circular muscle layer. And then just between the circular muscle layer and the longitudinal muscle layer, we have what we call enteric plexus. So that is part of the enteric, the nerves within the gastrointestinal system that help with the contraction and so on, the peristalsis. Then eventually we have the peritoneum. Yeah, which in this case will be the visceral peritoneum. Remember, peritoneum, just like pleura, we have parietal and we have visceral. So this will be visceral. Visceral is whatever covers the organ that is within that cavity. So the organs within the cavity that are intraperitoneal will include the small intestine, for example, the liver, and so on. So they have a peritoneum covering them.